we can talk about gross anatomy, right? The big structures that maybe we're already a little more familiar with. And so anyway, pelvis, you know, is a composite, right, of three bones, the ischium, ilium, and the pubic bone. You guys, I'm sure, already remember that, and that those three bones fuse. They come together, and the point where they all three touch is at the center of the acetabulum of the hip, or the hip socket, right? And you can see that on the figure that is on the right side of the slide. The acetabulum of the hip, obviously, as we get older, like any joint, it gets a lot of wear and tear. Sometimes develop arthritic changes, unfortunately, and sometimes as a consequence of that. And in women especially, a condition called avascular necrosis of the hip can occur, compromising this bony structure. Now, the pelvis is an important consideration for us because we're very interested in the muscles that provide a synergistic contraction of the pelvic floor musculature, right? Remember the co-contractors of the pelvic floor. The ones that we concern ourselves with most are the transversus abdominis, the lower extremity adductor, and the gluteal muscles. But we also give a nod to the importance of the external hip rotators as important co-contractors of the pelvic floor. The lower extremity adductors insert along the ischium and inferior pubic ramus. Allison, can you just tell me if my cursor is running down the inferior pubic ramus here on your screen? It is on mine. I just want to see if...
Yeah, you're good right now, Bruce. It's at sync today, so it's good.
Good. So I'm just moving my cursor now, over the pubic arch here, right? And the lower extremity adductors, we know, insert along the inferior pubic ramus and all the way down to the ischium, right? Pilates instructors call this the sit bone. That's a better name for it. Doctors, physical therapists call this the ischial tuberosity. The transversus abdominis, we know, isn't just a bikini-shaped muscle, right? We know that it extends all the way from the sternum down to the pubic bone, right? And it's the deepest muscular layer of the abdominal wall, and it inserts along the top of the ilium here. This is the superior anterior iliac spine and the superior inferior iliac spine. And so we know that the deepest layer of the abdominal wall is here. Now, if we could flip this around and look at the other side of the ilium, we'd see a smooth, concave surface, a carved-out surface, kind of like this is carved out, a carved-out surface where the gluteal muscles arise. And so all of the muscles that are the important co-contractors for the pelvic floor have attachments in the pelvis. And that's not by accident, right? They co-contract with the pelvic floor because the pelvic floor is a postural stabilizing muscle, set of muscles that we use for balance and core stability. And that's the message, hopefully, that they is getting out to your clients on a daily basis. I exhaust myself in the office talking about the fact that Arnold Kegel, although an important visionary of the 1940s, didn't have a vision of the pelvic floor as an element of a larger neuromuscular system used for core stabilization, balance, and movement. Nobody would sit in a chair and condition their quadriceps by squeezing their quadriceps over and over and over again. That makes no sense. Therefore, we should not condition the pelvic floor by sitting in a chair and squeezing the pelvic floor over and over and over again, doing so-called Kegel exercises. That makes no sense. We should rather, like we would if we were conditioning the quadriceps, challenge the muscle by challenging the natural purpose of the muscle, and that is to say, performing movements that naturally engage and use that muscle. And that really gets at the core research that we did back in 2008 when we studied the effect of movement on pelvic floor.